A clinician and an embryologist coordination is very, very essential to give a positive result. On a broad spectrum, I would recommend, instead of going for day 1, day 2, day 3, go for day 5 embryos. Now, let's move to the fifth part of no IVF ICSI end to end, or say no IVF ICSI. So, the fifth part is, I think, very interesting and very need of the hour. Day 3 versus day 5 embryos. Okay. As we all seen in the last couple of discussion about the stimulation, about the protocol, about the IVF and ICSI, now the next step is the embryos. What embryos is going to be placed inside? In this, we need to have some clarity and depth of understanding how many days an embryo can be cultured in the IVF lab, and why it can be cultured for so many days, and what is an impact of it. The higher the days, is it something better? Day 3 versus day 5 embryos. So now let's understand what is happening, certain basic points. Exactly when the eggs that is entered into the fallopian tube, in the terminal portion of the fallopian tube, supposed to be the wider area where the sperms come there all the way from the cervix to the uterus to the fallopian tube terminal portion, the egg and the sperm fuse each other. And what happens is, from there, once the egg is become fertilized, that same egg will go on the backward direction. On the 6th day, it goes into the uterus and get attached to the uterus. This is called implantation. So the entire 5 days, when the embryo is getting cultured, when the embryo is growing, it is happening in the fallopian tube in the female's reproductive system. So what happens is, that same environment, temperature, fluid dynamics, everything is being mimicked in the IVF lab in an equipment called incubator. So that incubator will maintain that same, mimics the same methodology and same environment. Thereby it facilitates for that egg to get fertilized and grow further. So what happens is, after IVF or ICSI, once the egg is being injected, after 24 hours, they take that egg outside the incubator and see under the microscope whether that egg has got fertilized. Okay, when we see both the eggs, when both the nucleus are fused to each other, it means the egg is got fertilized. Now we need to have an understand, say for example, when we got 10 eggs outside, out of which 2 or 3 may be immature or over matured eggs, only 7 is an optimal matured, we call it as M2 size, M2 eggs. In that 7, when we have done IVF or ICSI, maybe we can make it as simpler ICSI. The next day, we see around 6 or maximum 5 to 6 eggs would have got fertilized, because very rarely we see all the eggs becoming fertilized. The reason behind this, it's a pool of eggs seen in both the ovaries. Imagine if that eggs which is being growing inside, they are not all of uniform size. Some may be on 1 or 2 plus or minus days. So when we pull that egg, and when we are growing the eggs also by stimulation, we don't get as a uniform pool. So what happens is, like, the given particular time in a particular month, a woman will grow only 1 egg and will facilitate for only 1 baby. So though we are doing artificially, not all will get converted into embryos. So it is a point that needs to be understood. So after that, say for example, after 24 hours after first day, we are seeing around 5 to 6 is being made as an embryos. As fertilization, it's called as zygote. The first day after the fertilization, we call that as a zygote, and that zygote is called as a cell stage. And that zygote starts dividing into 2 cell, 4 cell, 8 cell, 16 and 32 cells up to day 3. So we call up to day 3 from zygote, it goes through a stage called cleavage, and it's called embryos. On day 4, it goes through a transformation, start getting expanded, and that cleavage embryo is go through a process called compaction under morula. It becomes expanded, and then it is becoming a day 5, it's called as a blastocyst. So an embryo can grow maximally up to day 5. What happens is, if you see what is happening naturally, on day 6, that embryo which is formed in the fallopian tube reaches the uterus. On the day 6, it gets implanted, and from there, from the mother's blood circulation, it takes the required nutrition to grow further. So, when we grow the embryos in an IVF lab in an incubator, we cannot grow beyond day 5, because from day 6 onwards, it needs to get its nutrition for the survival from the mother's vascularity. That is the reason we cannot grow the embryos beyond day 5. So, day 5 we can wait and see. What happens is, in the earlier days, when the advent of IVF was there, to get a fertilization itself, because it's very new, because it's a purest environment. What we see, the internal environment, the fallopian tube, the uterus, it's all divine blessings and nature. So when we are trying to mimic the same thing, it's very difficult to reach that sterility, to cleanliness, to maintain that same environment. We need to put a mask, we need to completely cover us, we need to be very sterile, there should not be any contamination, there should not be any infection, which is advent for the growth of the embryos. So what happened is, in those days, when they see a day 1 or day 2, they transfer the embryos. So they get results in some cases, they get negatives in some cases, and the results were not very promising or very pronouncing in those days. So what happened is, over a period of time, the technology and the understanding and clarity happened. The sterility has improved. They have started growing day 2, day 3, day 4 and day 5. So now we need to understand, in my earlier message I told you that if on day 1 you are able to see from 7, we are getting 6 eggs got fertilized. On day 3, only 3 or 4 would have gone to the day 3 stage. Some 2 or 3 would have stopped the growth, which means they are not a real potent embryos. From day 3, which 3 or 4, on day 5 you might have seen only 1 or 2. See the progress. On day 1 we had 6 fertilized eggs. On day 5 we are landing up with only 1 or 2 blastocyst embryos. This is, we need to understand. So this is the progress. Transformation and transition takes place. So imagine if you are going to place a day 3, 2 or 3 embryos, what will happen? If you get a result, it's well and good. But if you get a failure, the embryo is not implanted, where is the problem? If you are able to troubleshoot, if you understand the reason for your negative result, it's a good thing. We can rectify that negative result and thereby fetch a positive result in the subsequent attempt. But if we are not able to understand, it's a fault of the embryos or fault of the endometrium or fault of both. Now the technology is going beyond that to that level. So when we place a day 3 embryo and if we get a negative result, we are questionable, which is the reason for this negative. That is why we recommend wait for day 5. See which is the best embryos. Now the next thing comes to the grading of embryos. So now we have seen day 3, day 4, day 5, and we grade the embryos as grade A, grade B and grade C. Grade 1 is an excellent or a good embryos. Grade 2 is an average embryo. Grade 3 is a low quality or a poor embryos. So when you get a pool of embryos, we can see how many are in grade 1, grade 2, grade 3. Say for example, on a day 5, you are having 4 blastocysts and 2 is grade 1 and grade A or grade 1. 1 is grade B and 1 is grade C. You have the choice to choose the best embryos and get it transferred. And grade B and grade C can be used, avoided, or if you are not getting the result in spite of keeping the grade A embryos, that 2 embryos can still give the results. We need to understand there are individuals who have got the pregnancies even with B and C embryos, and there are individuals who have got the negative result even by transferring grade A embryos. So just barely it is a grade B and grade C, we are not need to be discarded. We need not give it up. Let's try. We have a choice to select grade A. Imagine if this time during the embryo preparation, endo preparation, we are doing a freeze cycle and we are getting preparation for the embryo transfer. The endometrium and the uterus is not favorable. you can transfer the average embryos and reserve the good quality embryos for the subsequent months also. There is a lot of analytical thinking is required. A clinician and an embryologist coordination is very, very essential to give a positive result. And a positive results should come from you. You put your fullest thought, you have to give that positive thought, positive vibes, and that will get transformed to your clinician and the embryologist. It is my positive thinking and a very, very strong acceptable thoughts. This is something universal law. Nobody can deny this. So we need to understand, choose the embryos, choose the grading of embryos, and be analytical in thinking which embryos can be transferred at a given point of time, and reserve the remaining embryos, freeze the embryos for the future cycle, maybe for the second baby, or if it is failed in the first attempt, use it for the second time. So this is how we need to understand. On a broad spectrum, I would recommend, instead of going for day 1, day 2, day 3, go for day 5 embryos. Still in some semi-rural and rural areas, because of lack of embryologists or expertise, some embryologists come for a limited number of days. They are compelled to transfer the day 2, day 3 embryos and only for IVF procedure. It's all we need to understand. This is all best, but nothing that doesn't mean you should not transfer day 2 or day 3 embryos. It is giving an understanding and a clarity to you to go and check with your clinician when you are undergoing the procedure. What is your practice of transferring the embryos? Are you transferring day 2 embryos to me, day 3, or you are transferring day 5? How many embryos is a separate topic I am going to give. So that is why I am not spoken about here. How many embryos will come as a separate part. Okay? So with your paper and pen, note down the points, go and ask your clinician and the embryologist before enrolling and getting yourself into the engaging into the treatment. Good day. Let's see on the 6th part.